Thank you all for joining us today, and let's begin our program. I do want to mention these chairs here in the front are available if anyone wants to come in and sit down in front. My name is Tom Dodd. I'm the chair of the board of directors for Hudson Headwaters, and I'll serve as your MC today. As such, I have the unique pleasure to welcome you to our celebration for Salem Family Health, the network's 26th brick and mortar health center. Our program today will include brief remarks, followed by a ceremonial ribbon cutting. After the remarks, all community members will be invited to join us at the ribbon to celebrate. Then we will proceed inside the health center for tours, refreshments, and conversation. We also have staff available on site today to enroll new patients. Since the founding of Hudson Headwaters more than 40 years ago, the network has stayed true to its mission to expand healthcare access for all, regardless of income or insurance. This is made possible because of diverse partnerships that are committed to our communities. As you listen to today's speakers, you'll see the power of collaboration coming together to make this health center a reality for Salem and surrounding communities throughout Washington County. I want to take a moment to recognize some guests that we have joining us today. We have several healthcare partners joining us. Thank you for being here: Glens Falls Hospital, Saratoga Hospital, Washington County Public Health, Salem Fire Department, and Salem Rescue Squad. Also, thank you for joining us today from the Office of New York State Governor Hochul, Dan Wren, from Congresswoman Elise Stefanik's office, Reed Cronus, Senator Jake Ashby, from Assemblyman Matt Simpson's office, Kirsten McCain. And also we have many leaders here today from Washington County and the towns of Salem, Cambridge, Fort Anne, Hampton, Hebron, and other surrounding communities. Lastly, thank you to Betty Gillis, Director of Lake Champlain, Lake George Regional Planning Board, and all other partners and friends joining us today. On behalf of the Board of Directors, many of whom are here today, we thank you for joining and celebrating with us. I now want to introduce one of my colleagues on the board, Salem resident and business owner, Dina Ketchum.
Thank you, Tom. I would like to express my heartfelt gratitude to the leadership at Hudson Headwaters for choosing to invest in our community. I grew up nearby and returned a few years ago with my husband to renovate the former shirt factory here at Salem and to operate our furniture business out of it. When I first heard about the plans to develop Salem Family Health, it felt like someone was saying what we've all known, that our community was of great value and worth investing in. Salem is a town filled with people who take great pride in where they live and are deeply committed to caring for one another. In my 3 years serving on the board and as a patient myself, I've seen firsthand how Hudson Headwaters shares these values. It's evident that they hold the same pride and commitment to their work that my neighbors carry toward our community. They understand that healthcare extends beyond the exam room, and having them in the heart of town is truly a gift. It is now my pleasure to introduce the town supervisor and one of our greatest advocates of Salem, Sue Clary.
Welcome, everybody. You get organized. Good afternoon, everyone. 8 years ago, a simple conversation sparked a movement in Salem and its surrounding communities to address the critical need of rural healthcare access. Our first meeting, held at Senator Betty Little's office in Glens Falls, brought together Assemblywoman Carrie Werner, Dr. Tucker Slingerland, and Diane Chagru of Glens Falls Hospital. The discussion was focused and ignited a series of follow-up conversations, some in my own backyard. The discussion was focused and ignited a series of follow-up conversations. Sorry, I'm going to double take on that paragraph. At Assemblywoman Warner's invitation, we later shared our case for rural healthcare accessibility at the state level. Meanwhile, community members, boards, and nonprofits rallied, writing letters and advocating passionately. Paul Tomlinson would knock on my back door at 7 a.m. in the morning saying, "Sue, we really got to do something." And we brainstormed solutions while Albert, Sheldon, and Margaret made land acquisition totally possible. So I don't know if Albert and Margaret, if you're here, thank you.
Oh, they're there.
Are they here? So going on, the Historic Salem Courthouse welcomed the HHHN Mobile Health Van, and the Mary McClellan Foundation provided vital financial and emotional support through, as we know, a special friend, Dr. Puglowski, who has passed away. But he was like on speed dial. Wonderful, wonderful pediatrician. Salem Central School quickly partnered with HHHN, and we explored how funding streams like Medicaid and Medicare impact our local healthcare systems. From nursing homes to hospitals, medical practices to schools, every institution is working to keep our community healthy, and we're deeply grateful for their efforts. Our alliances continue to grow with the Chamber of Commerce, the Rotary, Pizza World, of course Pizza World. Okay, I don't know what the construction crew would be without Pizza World. Okay, so Washington County Board of Supervisors, Public Health, safety teams, and our Salem substation deputies all stand united. HHHN, you're now part of our family. We're thrilled to welcome 2 young Salem residences, HHHN's Dr. Hunter Sutherland and Glens Falls Hospital's Michaela Barrett. They're going to work in their hometown, along with others who are returning to contribute. Seeing younger generations able to work in Salem fills me with great joy and great pride. It's a wonderful, wonderful opportunity to see our youth come back home. I know young is relative, right? So, healthy communities thrive on employment opportunities, a school system that educates and cares for all, social networks and accessible health care, and safe, vibrant spaces to connect and create. Salem has all of this and more. Our people make this place truly special. A true heartfelt thanks to Hudson Headwaters and Glens Falls Hospital for partnering with our community and personally for your compassionate care for my mom. This all affects us personally, and I certainly have had that in my family. So as I'm, off kilter, my little one's beeper's going off over here. And so our passion for Salem and its people burns bright, fueled by simple conversations at kitchen tables, under trees, or as stewards. Today is proof that together, following our vision and hearts, we can achieve extraordinary things. So in the meantime, I have this, and I have others out in the audience, if you want to put them up. This is all from the students from Salem. So we're gathering these posters because these are now Hudson Headwaters. Thank you. Thanks, everybody.
Thank you.
Thank you, Supervisor Cleary. Ladies and gentlemen, please join me in welcoming family physician and CEO of Hudson Headwaters, Dr. Tucker Slingerland.
Thank you everyone for being here today. It's really remarkable to look out and see so many familiar faces. People who are new friends, old friends, but also lots of neighbors, and that means the world to us. I think, today when you go inside here, you'll see probably the single best example of what a community health center really is. This is a masterpiece, but its story, I think, is probably the best way I can thank everyone that's contributed to it, because it really has been a group effort. And this center will serve generations to come for many, many years, and all ages, young and old, and everything in between. Women's health, This center will have a pharmacy at some point. It has lab services supported by Glens Falls Hospital. I got my blood drawn this morning, and Glens Falls Hospital got the job done, and it was almost painless. It was really amazing. But the story here really goes back to our mobile unit, which we feel very fortunate to have. And one of our first deployments of the mobile unit was to the Salem Historical Courthouse. And I volunteered to come as one of the providers. And if I were the CEO, I tell people that's the job I would do, because working in a mobile unit that's able to pull so closely to a community is really enjoyable. But during that day, I met a few key patients, which Sue might have had something to do with, because one of them was Margaret Sheldon. And Margaret had been looking for access to care, and we talked about it. And I said, yeah, we someday hope to find property here in Salem. And she said, well, I might know somebody. And so the next thing I know, I'm visiting with Albert. And Albert said, well, I have a piece of property I could show you. And I got in his pickup truck, and we drove around, and all of a sudden he veered off the road into chest-high grass. And, you know, unless you know the land really well, I wouldn't advise that. But he knows the land really well, like the back of his hand. And we pulled into this parcel, we walked around, we threw rocks off the field into the hedgerow. I walked through the hedgerow and checked out the stream, and we even ventured into the house that was here, and we thought, well, this is a great location. But getting from that to this took a lot of people, including our amazing architects from Holt who are here, who spent a lot of time here trying to appreciate the landscape. One of my favorite professors in college is Chief Satterthwaite, who's also a neighbor. And Chief always emphasized the importance of landscape. So there are roof lines here and gabled roofs that I think is a nod to the rural landscape. And we put a lot of time and thought into that. Bass Hatfield, our ever reliable builder, took on the project. Immediately we had issues with the ground. And yeah, I think ask any neighbor here, and yes, there is slate here, but under the slate, there's bedrock, a lot of it. And nothing that a few truckloads of dynamite didn't remedy, and now we've got great fencing made of bedrock. But they worked through that challenge, and Dal and Chris Hawks, who are also here, super talented folks as far as getting buildings built and done. And they persevered, and but that again was only part of it. And we needed this building to feel especially comfortable. We wanted to feel like you're at your own home. This building, more than any, is full of art, much of which came from artists in the community, and we feel really good about that. Christina and Dina did a great job, along with our facilities team. Hanging the art. Our IT team spent a ton of time in here. There's amazing technology in the walls of this building. Our executive team spent a lot of time, finance team, figuring out solutions here, but the culmination is this building. And one thing that's especially unique here is our teaching kitchen. We have never done this in a health center before, but Dr. Sutherland and Kelsey and crew are very interested in food as medicine, and no better place to try that. And but again, to make that work, we needed more help and more support. And the Dake family and Stewart Shops came through and underwrote the teaching kitchen, which folks should see. We really appreciate it. I passed 5 Stewarts on the way here from Glens Falls, but I also passed 2 or 3 Hudson Headwaters locations. And Susan and I often joke about, you know, if there's a Stewart's, there's usually a Hudson Headwaters within sight or within a mile. And your growth in Vermont may be hard to match, but we really value that partnership. And the Mary McCollum Foundation, again, underwrote the curriculum that will be happening in that space. So regardless of cost, this will be open to people, all people, to learn about healthy eating and their health. I have extensive talking points, none of which I usually use, but I just do want to look at them to make sure I'm not missing anyone here. But our providers we're super thankful for. These are brave 3 who will be, I think, instantly popular here in Salem. And I think the other part that should be mentioned is 2 other things, and I'll be done. Is that this building also represents jobs. So there will be people and jobs here that didn't exist this week, but will exist as of Monday. And those are really valuable. I mean, these are jobs that people can do without having to commute a long distance. These are jobs that serve neighbors, family, community, and that's what we want to support. And I think we feel really, really good about that. I think also, just looking out over the landscape here, having great neighbors is really important to us. Woody Hill Farms and the employment that they represent is also valuable to this community, and we feel like we're providing state-of-the-art healthcare here, but there are also many other state-of-the-art activities here in Salem that everyone should be proud and thankful for. My last comment is just related to something that's probably not obvious to most, but 340B is a pharmacy-related program that absolutely funded a building of this scale. So that program is currently facing real erosion, but one of the key requirements is that covered entities like Hudson Headwaters, Glens Falls Hospital invest those funds back in communities. So this is that investment. And we've done this time and time again across the North Country. The region is better for it. It's a program that we want to support and defend. Many of you have gotten our magazine, which we send out a ton of. There's lots of good reading in there about 340B, but again, in the end, what matters most is the relationships, and we feel very good about the relationships here and their contributions. So thank you everyone for being here. Make sure you check out the space. I helped design it, but even with that, there's surprises there, and it's really well done. And welcome.
Thank you, Tucker. This concludes our remarks portion of the program. We invite you to join us for the ribbon cutting, followed by tours and refreshments inside this new community resource. Thank you again to everyone attending today.
Albert, give us some muscle, all right?